Chapter 11, Muscles of the Body, Part 2. So, we last left off talking about the muscles in the trunk of the body. Here you can see the diaphragm again, sheet-like muscle between the thoracic cavity and abdominal cavity. The cut of the external oblique, the most superficial lateral muscle, followed by the internal oblique, which is deep to the external oblique, followed by the transverse abdominis, which is deep to the internal oblique. So from superficial to deep, it goes external oblique to internal oblique to transverse abdominis. And then, of course, in front, anterior, is the rectus abdominis. Hernia. Hernia is when there is a opening, perhaps damage to the wall of the abdominal wall that allows the intestines to push through. The hernia is something that needs to be corrected, usually through surgery. However, it is not an emergency room sort of thing. Usually you just notice an extra bump somewhere on your abdominal wall or near it, and then you go to see the doctor and they schedule surgery, and then they will repair the injury and put a mesh to prevent the intestines from pushing back through. All right, the pelvic region, the floor of the trunk of the body. There we have a collection of muscles that we will collectively call the levator ani muscles. They form the pelvic floor and they support the pelvic viscera, so it's held up. All right, moving on to muscles that move the pectoral girdle. This is the scapula and clavicle. All right, so for instance, we start with serratus anterior. It's a lateral muscle, has lots and lots of different leaflets, as it were. They all go around to the back and insert into the scapula. So they start at the ribs, that's their origin. They insert into the scapula, and when they contract, they depress the scapula. So if you already had your shoulders raised high, they would pull it down, and they can pull the scapula anteriorly. They can help you slouch, as it were. Then we have the trapezius muscle. This is a big sheet-like muscle, very superficial on the upper back. Its origin is the occipital bone and the vertebra. Its insertion is into the scapula and the clavicle. And it is able to do quite a few different motions. It can elevate the scapula, so raise up your shoulders. It can depress the scapula, pull them back down. And it can retract the scapula, so that if you're slouched, it can pull them back, so you have your shoulders pulled back and are in good posture position. Now, the reason why the trapezius is able to both elevate and depress the scapula is because, again, the entire muscle doesn't have to contract. So if the superior muscles parts of the muscle contract, that'll pull the scapula up. If the inferior muscle fibers contract, then that'll pull the scapula down. All right, then we have the rhomboids, two little muscles on the back. They are underneath trapezius. They have their origin. Their origin is in the vertebra, and their insertion is in the scapula. And what they're able to do, they can elevate the scapula. So based on their angle, they can help to pull the scapula up. And they're also able to retract the scapula, to pull it back so that you go from slouching to having a good posture. Then we have muscles that move the humerus. So moving on to muscles that move the humerus, they insert into the humerus. We have pectoralis major. This is an anterior muscle. It's relatively large, and it inserts into the humerus, toward the front of the humerus. Its origin, clavicle and sternum, its insertion into the humerus. And what it is able to do is allow for flexion of the arm at the shoulder joint and adduction of the arm. So if your arm is already pulled out, it'll help to pull it back down. So flexion and adduction at the shoulder joint. The previous muscles we talked about were moving the entire shoulder structure, the pectoral girdle. These muscles now are just moving the humerus, the arm at the shoulder joint. On the lateral sides of the shoulders, we have the deltoid muscle. It's a very broad muscle wrapping all the way around, inserting into the lateral side of the humerus. It's able to do flexion of the arm, so help to pull the arm forward. It's able to do abduction, so it can help to raise the arm, to pull the arm out. And it can do extension of the arm, so it can pull the arm back. Again, the reason why it's able to do both flexion and extension is because it is a very big muscle, so if the anterior portions of it contract, it does flexion. If the posterior portions contract, it does extension. Continuing, we have the teres minor and teres major. Teres minor, small muscle, that's origin on the scapula, inserts into the humerus, and it's able to laterally rotate the arms. So at the shoulder joint, moves the arm so that it's being laterally rotated out. Teres major is slightly larger muscle. Its origin is also on the scapula, inserts into the humerus. It's able to help in extending the arm, helps in adduction or pulling back down, and it also engages in medial rotating the arm, medially rotating the arm, so pulling the arm in at the shoulder joint. We also have the latissimus dorsi muscle. It's a very broad sheet-like muscle on our back that then wraps around and inserts into the humerus. So its origin, vertebra and sacrum, it inserts into the humerus. It's able to help to extend the arm, to pull the arm back, and adduct the arm to help pull the arm down. Again, if these motions, extension, adduction, abduction, etc., you're not comfortable with, you definitely should take a little time to review what those terms mean. All right, so compartments of the arm. Moving on to the compartments of the arm. There's a posterior compartment and an anterior. The anterior compartment is involved in flexion at the elbow. The posterior compartment is involved in extension at the elbow. So, biceps brachii, anterior muscle. It crosses two joints, the shoulder joint and the elbow joint. Its origin is the scapula, its insertion the radius. And at the elbow, it is able to flex the forearm at the elbow, so bend the elbow. However, since it also crosses the shoulder joint, it is also able to flex the entire arm at the shoulder joint. Biceps brachii is underneath or posterior to the biceps brachii, so it's underneath it. However, it's still anterior. It's still on the front of the humerus, so it's in the anterior compartment. Its origin is in the humerus. It inserts into the ulna, and when it contracts, it flexes the forearm at the elbow. Then we have brachioradialis muscle. It crosses the elbow joint. So its origin is in the humerus. It inserts into the radius. And it is also able to do flexion of the forearm. So helps to bend the elbow to flex the forearm. Then in the posterior compartment, we have triceps brachii. So this is in the back, posterior side of the humerus. It inserts shins, include the scapula and the humerus. My mistake. The origins is the scapula and the humerus. Insertion is in the ulna, so it crosses two joints, the shoulder joint and the elbow joint. So it's able to do extension of the forearm, so it helps to straighten out the arm at the elbow. And it's also able to do extensions at the shoulder joint, pulling the arm back down. In the wrist, we have a collection of muscles that we will call the flexors. Their origin is the humerus. They insert into the metacarpals and phalanges. You don't need to remember their specific names, but as you can see, a lot of the names involve the word flexion. So they help to flex at the wrist, to bend your hand, making your palm move anteriorly at the wrist. On the posterior side, we have the extensors. Again, you don't need to learn the names of these muscles. They are just going to be collectively known as the extensors. They're on the back side, and their origin is the humerus. Their insertion is the metacarpals and phalanges. And again, when they contract, they cause extension. They help to straighten back out the wrist and hand. Moving on to the thigh. So going down to the legs, the thighs have three compartments. They have an anterior compartment, a medial compartment, and a posterior compartment. First up out of the muscles is the iliacus. Iliacus muscle has its origin on the pelvic girdle and inserts into the femur. So here it is. Iliacus is able to help to flex the thigh, so it bends the leg at the hip, flexes the thigh at the hip joint. We have a small little muscle nearby called pectineus. See here, pectineus at an angle. Its origin is the pelvic girdle, inserts into the femur, and it helps in adductioning and pulling the leg back down. It's stuck out to the lateral side. We also have adductor longus, a bigger muscle. Adductor longus's origin is the pelvic girdle, inserts into the femur, and it also, surprise, surprise, helps to adduct the thigh at the hip. If we go on a posterior view or an anterior view, either way, this muscle, adductor magnus, is underneath adductor longus. Adductor magnus, again, helps to adduct the thigh. Its origin is the pelvic girdle. It inserts into the femur. Then we have gracilis. Gracilis is a very medial muscle, very thin, and it also helps to adduct the thigh. Its origin, pelvic girdle, inserts into the tibia. Then we have flip the leg to the posterior view. We see this large muscle, gluteus maximus. Gluteus maximus, origin is the pelvic girdle. It inserts into the femur, and it helps to extend the thigh, to pull the thigh back down at the hip joint. Gluteus medius is underneath gluteus maximus. This is a smaller muscle, and its origin is the pelvic girdle, inserts into the femur, and it helps to abduct the thigh at the hip. So it helps to pull the leg out laterally. Artorius is this thin strip-like muscle going from the anterior superior iliac spine all the way across to the tibia. It is a thin strip of a muscle. It helps to rotate the thigh, to laterally rotate the thigh, pull the leg, twist the leg so that it's sort of the knees going laterally or out. And it also, because it crosses the knee joint, helps to flex at the knee. Biceps femoris is one of the hamstrings. It is in the posterior compartment, and its origin is the pelvic girdle, inserts into the fibula, and helps to flex the leg. So it helps to flex at the knee joint. We have semitendinous, another muscle in the posterior compartment. Its origin is the pelvic girdle, inserts into the tibia, and it also flexes the leg at the knee. So it bends the knee. And then finally, underneath semitendinous, we have semimembranous, and it also flexes the leg at the knee. And its origin is the pelvic girdle, inserts into the tibia. So those are the three hamstring muscles. Then we have the quadriceps muscles. Quadriceps femoris is an anterior most of the quadriceps, which are all in the anterior compartment. It crosses both the hip joint and the knee joint, so it can extend the leg at the knee joint and flex the thigh at the hip joint. Then we have vastus medialis on the medial side, vastus lateralis on the lateral side. Their origin is the femur. They insert into the patella, and they help to extend the leg at the knee joint. And then the last of the quadriceps, quadra 4, is the vastus intermedius. It is underneath or deep to rectus femoris, and it also extends the leg at the knee. In the lower leg, we have a posterior compartment and an anterior compartment. In the anterior compartment, we have tibialis anterior toward the front. Its origin is the tibia. It inserts into the metatarsals in the foot, and it helps to dorsiflex the foot to move the foot, the toes, so they're going up. We have laterally the fibularis longus muscle. Its origin is the fibula, inserts into the metatarsals, and it helps to evert the foot, turn the bottom of the foot so that the sole of the foot is facing outward laterally. We have gastrocnemius, a very large double-headed muscle on the posterior compartment. Its origin is the femur, inserts into the calcaneus, and it plantar flexes the foot, makes it so you can stand on tippy toes. And then underneath gastrocnemius, we have soleus. Soleus has its origin in the tibia. It inserts into the calcaneus, and it is also able to plantar flex the foot. And that is it for this part of this lecture.